Founded as a single health plan in 1984, Centene Corporation has established itself as a national leader in the healthcare services field. Today, through a comprehensive portfolio of innovative solutions, the company remains deeply committed to delivering results for its stakeholders, state governments, members, providers, uninsured individuals and families, and other healthcare and commercial organizations. Ladies and gentlemen, please welcome Shannon Bagley, President and CEO of Home State Health Plan for the Centene Corporation.
The health economy in St. Louis is not only at the forefront of delivering world-class health care, it is a major economic engine of our region. It accounts for nearly 200,000 jobs and over $7 billion in payroll. From the research in our labs and startups to discover new cures, to innovations in ensuring affordable access to care, to the care providers in our region. The health economy in St. Louis is a vital part of who we are as a region. We at Centene are proud to be a part of this great tradition and to give back by honoring this incredible industry and by presenting the Arcus Award for Achievement in Health. Our finalists have each demonstrated distinction in the health industry through their corporate leadership, innovation, and growth. But before we announce our winner, let's honor them all.
AW Healthcare is a local, privately woman-owned enterprise that serves the medical and personal care needs of homebound, aging, and disabled people.
Christian Hospital has been in North County since 1968. We have 2 campuses, both with full-service emergency departments. We're also the largest provider of emergency services in North County.
Coventry Healthcare is owned by Aetna, the 3rd largest health insurance company. Locally, we are one of the region's leading managed care companies.
EMED Medical was started in 1999, and our primary focus was pharmaceutical wholesale distribution. Since then, we've evolved into both providing pharmaceuticals and also providing specialty pharmacy services as well.
We're a nonprofit organization. We've been around since about 2009. Our job is we want patients to feel better, we want systems to flow better, and we really want to make sure that people understand what's happening when they're in their doctor's office.
Ranken Jordan is a pediatric bridge hospital. We take care of children that are transitioning between big hospitals and home, and we bridge that gap for parents.
So ROI is a leading healthcare supply chain company. We work with providers all over the world to help them insource supply chain services.
St. Luke's Hospital is located in Chesterfield. We've been around for almost 150 years. We've been at that location since 1975. We offer over 60 service lines in healthcare. We're a very large not-for-profit with almost 3,000 employees.
Veterans Care Coordination, we assist elderly veterans and surviving spouses. We help them become educated about a little-known program called Pension with Aid and Attendance, and we link up elderly vets and surviving spouses to the home care agencies that they desperately seek.
The company was founded by 3 Russian immigrants who found a need in the St. Louis area for in-home services for a diverse people. So they delivered high-quality care to people regardless of cultural differences or religious backgrounds and saw improved outcomes.
So the CHAP program is designed to provide health care to mainly lower-income people with problems that they keep repeating. In other words, they keep showing up in one of our 2 emergency departments. And we do that 2 ways. One way is we have 2 clinics now next door to each of those emergency departments, so we can treat them there. The other way we can treat them is through our EMS or our ambulance division. So if they call 911, we can send out a specially trained paramedic and treat them in their home.
The High Performance Network product is an innovative solution to healthcare because it does provide access to healthcare that individuals and families may not have ever had before. It is offered on the Missouri and Illinois health insurance marketplace. Caroling from Coventry was the leading product and most affordable in St. Louis in 2014.
We are the proud recipient of being one of the fastest growing minority-owned companies, and we've been fortunate enough to receive that award on multiple years, 2008, 10, and 12. And we were recognized for our exponential growth, not only here in the St. Louis region, but also on a national basis. And we're also was recognized for our distribution and logistics penetration in the marketplace.
Health insurance is a very complicated it's a very complicated thing to have and manage. So a lot of our work in health insurance literacy gets to that. So we're hoping that we can really empower people not only to learn how to get that insurance, but how to use it and then how to keep it.
Our philosophy is, you've got to get up and out and moving to start feeling better. You don't feel better just laying in bed all the time. And so we try to get the kids up and out doing things that kids should normally do, and so that the medical staff will meet them in that space. But what it does is that it teaches the child and the family that they're not stuck in bed just because they're medically complex. We really get back to living support, perhaps while you're on life support.
Healthcare systems spend money on really two things: people that provide patient care and the stuff that those people use. And the stuff that those people use, we qualify as supply chain. And for a healthcare system, that could be up to 50% of their entire expense base. So it should be very strategic.
So we focus on continually trying to improve the health of our community through specific training, through high-quality doctors, through wonderful employees, through programs that help educate the community so they themselves can take action on improving their health, working with employers in this innovative program that we've called Passport to Wellness, which now reaches 200 and more employers in the St. Louis area.
What really makes us unique is our Veterans Appreciation Program, which is where we pay for the veteran or surviving spouse's care while the VA is actually processing their claim. The story revolves around my grandfather, who was a World War II veteran, who could have taken advantage of this program, but because of lack of knowledge or education, my family went without it.
And the winner of the Arcus Award for Achievement in Health goes to Ranken Jordan, Pediatric Bridge Hospital.
As you can tell in the video, I'm pinch hitting tonight. I'm not Lori Tanner, but I strive to be her because she is a visionary for medically complex kids and their families. This is a population of kids that's growing 10% a year. They are driving 30% of the healthcare costs. And Ranken Jordan provides the only bridge hospital in the world for these kids and families. Lori mentioned the bridge that we send these kids and families across to get from acute care to home. We could not do that without the supports that are under that bridge. Our nurses, our therapists, our doctors, and our 350 staff lead the way every day. Our donors and supporters, many of you who are in this room, help us do that. At least 2 of our board members are in the room, Tom Minogue and Thad Simons. We could not do it without your help. And if I've forgotten any other board member in the room, raise your hand and let me know. But thank you very much. We love being part of St. Louis, and we love leading healthcare innovation for medically complex kids and their families. Thank you.